So I have this article, and it says children may carry coronavirus at high levels, and the study finds. And so this I was looking at because they have so much talk around opening schools. So this I was looking at on Yahoo. So it has been a comforting refrain in the national conversation about reopening schools. So this is by Apurva Mandavilla out of New York Times. So young children are mostly spared by the coronavirus and don't seem to spread it to others, but at least not often is what they're saying. But, and there's a but, strong one. Thursday, a study introduced an unwelcoming wrinkle into the smooth narrative. Infected children have at least as much coronavirus in their noses and throats as infected adults, according to the research. So indeed, children younger than 5 host up to 100 times as much of the virus in their upper respiratory tract as adults. This is what the authors have found. So that measurement does not necessarily prove that children are passing the virus to others, but still, the findings should influence debate over whether they should reopen schools, several experts have said. So still, the school situation is so complicated that there are many nuances beyond just the scientific one. So Dr. Taylor Harold Sargent, a pediatric infectious disease expert at Ann and Robert H. Lurie Children's Hospital of Chicago, who led a study published in JAMA Pediatrics, or JAMA Pediatrics. But one takeaway from this is that we can't assume that just because kids aren't getting sick or very sick that they don't have the virus. And so that's the problem. So a lot of parents assume because they don't see the kids getting sick that they must not have the virus or they don't catch it. So that's not true. The study is not without caveats. So it was small and did not specify the participants' race or sex, whether they had underlying conditions. So the test looked for viral RNA genetic pieces of coronavirus rather than the live virus itself. So it's genetic material, RNA, not DNA. So still experts were alarmed to learn that young children may carry significant amounts of coronavirus. So I've heard lots of people saying that, well, kids aren't susceptible, kids don't get infected. And so I've heard that as well, but that doesn't mean that they couldn't give it to adults. So clearly this shows that's not true. So this is by Stacy Schultz Sherry, a virologist, St. Jude's Children's Research Hospital is where she works. And so I think this is an really important first step in understanding the role that kids are playing in the transmission of this coronavirus. So Jason Kindrachuk, a virologist at the University of Manitoba, said now that we're rolling into the end of July, looking at trying to open up schools next month, this is really the need to be considered type of situation. So they need to be talking about this a lot more, trying to decide what's safe and what's not safe. And I'm adding that in there. So the standard diagnostic test amplifies that the virus genetic material in cycles, with the signal growing brighter each round. So the more virus present in the swab initially, the fewer cycles needed to clear the result. So Harold Sargent, or Healed Sargent, in other words, who has a research interest in coronavirus, began noticing the children's tests were coming back with a low cycle threshold, or CT, suggests that their samples were teeming with the virus. And so, intrigued, she called the hospital lab on Sunday and asked to look back at the test results in the past several weeks. It wasn't even something that we had set out to look for, she said, but she and her colleagues analyzed samples collected by the nasopharyngeal or pharyngeal swabs. And so I guess that's the nasal cavity or nose passageway between March 23rd to April 27th at a drive-through testing site in Chicago from the people who came to the hospital for any reason, including symptoms of COVID-19. They looked at swabs taken from 150 people, 145 people rather, and 46 children younger than age 5, 51 children ages 5 to 17, and 48 adults ages 18 to 65. So, to forestall criticism that really ill children would be expected to have a lot of the virus, the team excluded children who need oxygen support, but most children in the study reported only fever and cough. So, Heal Sargent said this. So, to compare the groups fairly, the team included only children and adults who had mild to moderate symptoms, for whom they had information about the symptoms and how they began. So, Heal Sargent left out people who didn't have symptoms, who did not remember when they had started to feel ill, as well as those who had symptoms for more than a week before testing. So the results confirm Heal Sargent her hunch that she had older children and adults had similar CTs. So with the median of 11 and ranging from up to a 17, but children younger than age 5, significantly their CTs were lower CTs about 6.5. Upper limit of the range in these children was a CT of 12. However, still comparable to those of older children and adults. And so it definitely shows that kids do have levels of the virus similar to or maybe even higher than adults. So kids might even have a higher amount of exposure to the COVID, because what have we been hearing that some kids don't require masks because they can't breathe out of it or they might choke. And then that's for the really younger ones. And then you have kids that are running around playing with other kids, and they may not be able to keep a mask on or social distance. They don't understand, they're young. And so they're getting around all these other adults in their family who might have come in contact with it. So that's possibility for, like, if they go to school, now these kids have the virus, they're carrying it in their bodies. So what does that say about the teachers that are going to be around them and working with them, and then other children that may not have it or may have not been exposed, that might have health issues? What's that going to do with them? It's going to infect them. I feel like the reason why we haven't really seen that many kids or a lot of kids being impacted is because schools are not fully open. But once they start fully opening the schools, and so I'm adding this in, that's when the numbers of kids, we're going to see kids that are infected, kids that maybe have mild to moderate symptoms, and then more kid deaths, unfortunately. And I believe that's what's going to happen if they start reopening schools like they were opening businesses, where more people have come in contact with this virus. And so that's my opinion on the matter. But it says, in a recent study in France found that asymptomatic children's CT values similar to those of children with the symptoms. So a kid that doesn't have symptoms or doesn't show symptoms, but they may have been infected or exposed to it, they have as many of the similar I believe, like maybe if they take a test, it shows up that they are infected even though they don't show signs of cough and fever. And so it's just as if someone had symptoms. So CT values are a reasonable proxy for the amount of coronavirus present. And this was said by Kendra Chu, who relied on the metrics during the Ebola outbreak in West Africa. So still he and others said that ideally researchers would grow infectious virus from samples rather than test only for the viruses in RNA. So I suspect that it probably will translate into the meaning that there is more actual virus there as well. But we can't say that without seeing the data, said Juliet Morrison. So a virologist, she's from University of California, Riverside. So some RNA viruses multiply quickly and are prone to genetic errors that render the virus incapable of affecting cells, but some RNA detected in children may represent defective viruses. So we need to understand how much of that is actually infectious or infectious virus. And so this is by Schultz Sherry. So the researchers said that they did not have access to the type of high security lab required to grow infectious coronavirus, but other teams have cultivated the virus from children's samples. So the experts all emphasize that their findings at least indicate that children can be infected. So you hear that? Children can be infected by this virus. So that would mean the more children you get in a classroom, what is going to happen with kids that might have health issues and staff, teachers that have health issues? More than likely they're going to become infected. So those who harbor a lot of virus may spread it to others in their household or to teachers and other school staff members when schools reopen. And so why are we haggling over this? That is the reason why teachers are going on strike. That is the reason why teachers are afraid to go back to work. Not because they don't want to work, because they're afraid that more kids will get infected and more virus will spread and innocent people will die, like what is happening now, and kids will die. And so this is a huge problem. So many school districts are planning to protect students and staff alike by implementing physical distancing, cloth coverings, hand hygiene, cleaning, but it's unclear how well staff members and teachers can keep young children from getting too close to others. So this is a Kendra Chu who said this. So frankly, haven't seen a lot of discussion about how that aspect is going to be controlled, they said. So observations from the schools in several countries have suggested that at least in places with mild outbreaks and preventive measures in place, children do not seem to spread the coronavirus to others efficiently. However, like Florida, Arizona, and Texas, places where the virus has spread, and like every day you're hearing in the news about how people are dying and how many more people are infected, may not be a good idea to open up schools. So strong immune responses in children could limit both how much the virus they can spread to others for how long. So children overall's health underlying conditions such as obesity or diabetes, and also their gender, sex may also influence the ability to transmit the virus. Some experts have suggested that children may transmit less virus because of the smaller lung capacity, height, and other physical aspects. So Morrison dismissed those suggestions. So the virus is shed from the upper respiratory tract, not the lungs, she noted. We are going to be reopening daycare centers and elementary schools, she said. But if these results hold up, then yeah, I'd be worried. So this article originally appeared in the New York Times. So this basically is telling you that it is a risk opening up these schools. It's basically letting you know that kids can contract the virus and more people will get sick. Kids and adults alike can get sick. People who are compromised physically from illnesses like diabetes and other illnesses, possibly those people will have more of a severe problems with contracting this disease. And so that's this video in terms the first part of this video in terms of kids. The other part of this video that I was going to shift gears on was the California extending the moratorium to September. And so I was looking at this, and this is California. So every state, every city has different rules. And so there's a video attached to it, and it's pretty scary because this thing has dragged on for months now. It's almost half a year that it has dragged on, 4 or 5 months, so what, 6 months, half a year. So California extends moratorium on evictions through September. So this was out in July of the 2nd of July 2020. So this is Tom Waite and out of CBSN, and he's talking about how this virus has really just taken a toll on California. So Los Angeles CBSLA with a spike in coronavirus cases statewide, forcing authorities to reinstate restrictions. So Governor Gavin Newsom Tuesday gave local governments the authority to halt renter evictions through to September. So Newsom signed an executive order which gives counties the green light to prevent property owners from evicting tenants all the way through September of 30th. So LA County Board Supervisor last week extended its own local moratorium on evictions through July 30th. So the residential and commercial tenants are the ones that has extended. So the county-wide moratorium applies to all local jurisdictions unless they have enacted their own moratoriums. So that's why I was saying, so every state, every city, jurisdiction has maybe some different rules in place. So under the county moratorium, residential tenants are given up to about 12 months after the moratorium expires to repay missed rent. So you work that out with your landlord individually, and it's a case-by-case situation. And so also, last week, LA City Council voted to use $100 million from the CARES Act to provide relief to residential tenants and landlords that were hurt by the economic effects of this pandemic of COVID-19. So tenants are eligible if they earn 80% of the average median income once approved, either $1,000 for a month's rent up to about $2,000 per household will be paid directly to their landlords. And so that's not very much, but it's a lot if you are trying to buy yourself some time, maybe until you decide to go back to work, seek some other type of employment, or maybe it might help pay, rent for a month or two so you can purchase more, necessities in your household until you figure out what you're going to do. So in April, LA City Council voted to move forward with a plan to freeze the rents and the rent increases for a period of about 1 year for older apartments that are protected by the city's rent stabilization ordinance. So this was last October. Newsom signed a law which caps annual rent increases at about 5% for any housing that is 15 years or older. And so that's pretty much that right there. There is a video, so I'm going to play this video, and then I'm going to go into this part of the, it's a video within the video, and I'm going to go into more on what I discovered is going to probably more than likely happen. I'm just going to give you my opinion on what probably will end up happening. Even though they have these moratoriums in place for however long, they're going to help some people, but they're not going to be able to help everyone. And the rent relief fund programs and all these other things might help some people, but it's not going to be able to help everyone because not everyone was in the same exact situation. Some people may have had a job and they were like getting by from month to month and they were doing okay, and then this pandemic hit and then it changed life around for them financially. However, you have some people, maybe they already were behind in rent way before the pandemic. And so those are the people I believe that might end up in a situation because they were not, maybe not paying rent, they were squatters, maybe they were just rent burdened. Maybe they just were not responsible. There's a lot of maybes, that's what I'm saying. So everybody's situation is different. You do have some people who maybe they just were really rent burdened. They couldn't catch up with rent and they got far behind. Or you have some people maybe they just weren't responsible financially and they were living beyond their means. They were buying things that they probably shouldn't have bought and they got behind in rent. This might have happened before the pandemic. The pandemic is helping them so that they don't get evicted. Maybe they already have eviction waiting. Um, then you have people who are just troublesome individuals and they're troublesome tenants and they need to be, moved on somewhere else or go to some other location because they're a problem for other people to live around. So there's situations that are different, a case by case situation. So everybody's thing is not the same. Then you have some people who have health issues. They had to stop working. If they go back to work knowing that this disease is out here, which I really feel for these individuals because there are some people, many people like that. They might have diabetes, they might have heart problems, they might have cancer, they might have other issues that are underlying, and they were working, and before this virus, they were able to work maybe part-time or they were able to work. But now that this virus is out there, they could get more exposure to people who might be infected, and this could mean their life. So they are instantly out of work. And so now that means they're instantly behind in rent because of health issues and the fear that they could die. And so this is some people's reality. And so I just wanted to say that. And so that's why this moratorium is helping some people and others it's helping some people who probably shouldn't really be taking advantage of the situation because some people out there really do need this, and that's what I was saying before in a previous video. But this right here was sad because it talks about the hospitals and how they're filled up, especially Florida. Um, and I was looking, they were trying to open up the schools for fall in Florida, and their virus cases have surged like really, really high. And so I don't know how they're going to be able to open up schools when they have so many people that are infected and a lot of people that are dying in Florida. But anyway, without going on, I'll play this video and then I'm going to give you some feedback on what I'm seeing or foreseeing happening with all of this.
As you said, they're running out of hospitals. California is getting canceled by Governor Newsom. At least the order affects 70% of the state and also includes ordered beaches be closed over the 4th, a surge that could push that.
We were able to bend California. We're going to bend the curve again.
Spiking 72% in the last 2 weeks. Weight traffic in percent of ICU.
They give us one N95 mask per shift.
And equipment after the pandemic began, and they're worried about safety. In New York, this indefinitely. President.
The reality of this situation from day one. Well, you know what, Mr. President?
The latest reality check, a cluster of cases in New York's Rockland County. 8 people at a large party infected and not cooperating with health investigators. Now the county has subpoenaed them.
I will not allow to have the health of our county.
New infections in Texas are soaring to an all-time high of 8,076 cases today. More than 6,900 are hospitalized with the virus.
Patients.
Sorry, I was going to play that
With
again.
COVID cases surging, it's so bad that, as you said, Governor Gavin Newsom announced new closures today that will impact tens of thousands of businesses across the state. And in other states, as you said, they're running out of hospital beds, especially in Texas. Dining indoors in California is getting canceled by Governor Newsom, at least for the next 3 weeks. The order affects 70% of the state and also includes bars. Newsom had already ordered beaches be closed over the 4th of July holiday weekend, fearing a surge that could push the health system to the brink.
We were able to bend the curve in the state of California. We're going to bend this curve again.
With COVID cases in California spiking 72% in the last 2 weeks, the situation is catastrophic. In Riverside County, 90% of ICU beds are full. Nurses are sounding the alarm.
They give us one N95 mask per shift.
Angel Moreno says staffing and equipment shortages are still happening months after the pandemic began, and they're worried about safety. In New York, the city postponed indoor dining indefinitely, and the governor lashed out at the president.
He denied the reality of this situation from day one. Well, you know what, Mr. President? Reality wins.
The latest reality check, a cluster of cases in New York's Rockland County. 8 people at a large party infected and not cooperating with health investigators. Now the county has subpoenaed them.
I will not allow to have the health of our county compromised because of ignorance.
New infections in Texas are soaring to an all-time high of 8,076 cases today. More than 6,900 are hospitalized with the virus.
The patients end up basically backing up in the emergency room. They're quote-unquote boarding in the emergency room because there are no beds in the hospital for them.
At this Houston emergency clinic, desperate measures.
We had to send patients as far as Huntsville or Galveston, which is from here, if you do the map, it is more than 50 miles away.
San Antonio is emerging as a hotspot, cases nearly doubling in 10 days. More than 800 nurses are coming in to help.
The numbers speak for themselves. I'm very concerned and I'm not satisfied with what's going on because we're going in the wrong direction.
After Dr. Anthony Fauci on Tuesday called out Texas for reopening too quickly, Lieutenant Governor Dan Patrick blasted him.
He doesn't know what he's talking about. We haven't skipped over anything. The only thing I'm skipping over is listening to him.
We have a right in America not to wear a mask.
Meanwhile, more people defying orders to wear masks are making headlines. This time at a 7-Eleven store in Fort Worth, Texas, where a customer refused to wear one in order to buy something. Today, President Trump was asked once again whether he would wear a mask.
I'm all for masks. I think masks are good. If I were in a tight situation with people, I would absolutely look like the Lone Ranger.
But he went on to say he did not support a national mask order, something states and cities are deciding on their own. But there's potentially good news on the vaccine front. 2 companies, Pfizer and BioNTech, say clinical trials are showing positive results, but no timeline on how soon a vaccine could be ready. And even if and when the vaccine is ready for the public, rolling it out to tens of millions of people will be another unprecedented challenge.
So that is pretty much on that. And so what I'm gonna stop it because it's gonna replay the video or it's gonna play some other video, so I'm gonna get off of that. Let's see if it clicks off on that. So what I noticed is that earlier on I had saw in some articles they were showing some shelters, and here in LA and some other various places they're starting up some shelters. They're COVID-19 shelters, but some of them are for, they started off with some of them for people who were infected, and now they have some other types of shelters that are shelters for homeless, newly homeless families and people, because once these moratoriums end, there is possibly going to be more homeless people. So you have people they're going to be able to help, and unfortunately people they're not going to be able to help, even if they wanted to help. And so I had a video that showed the end of rent now. They have groups where they're trying to get rid of and waive all of the rent, or basically forgive the rent during the pandemic. Unfortunately, that's not going to be able to help those people who already were in danger of being evicted before the pandemic started. And they're just getting more and more behind in rent. So it just makes it worse. It exacerbates it. And then you have people who might be sick because they're newly infected individuals. And so that's problematic. So what I was seeing is I kept looking on here for these shelters. And Los Angeles and some other places might come up. So these, I believe, are shelters for people who might, it says men are less likely to wear masks. They are also dying of coronavirus at higher rates in LA County. So that's something new. But and I have seen that, by the way. But this was a shelter that came up because we already in LA, we had a problem with homelessness. So LA opens temporary homeless shelters during COVID-19 pandemic. I think this might have been when they had to clean up the streets where homeless people were living. And they had some of these shelters that were open, but they didn't know whether people already were infected. But I believe what's going to happen is they're going to have more of these shelters that are going to open up because they're going to have people who are newly homeless. And you're going to see a lot more of these homeless camps, homeless shelters. And so this is what I was foreseeing, that there's going to be more of these homeless shelters because this is what LA was dealing with right here. And we're still dealing. This is LA County. And this, it says more deaths, outbreak at Skid Row, homeless shelters in Hollywood as well. And so these are the things that we were dealing with, homelessness already in LA. It was a big problem. People that are on bus benches, they're on the street and they have no place to go. And so this is going to be really, really sad because you have newly homeless families and they're victim of a circumstance. And so this is what we've seen in LA. I believe more of this is on the way. Some people are going to end up on the street even more so because they're not going to be able to have room for some of these homeless shelters. They're going to have rules, and some people are not going to want to follow those rules. You might have to wear a mask. That's going to be a problem we can see. Some people are probably going to decide to live in RVs. That might be a big thing. And then there's going to be more crime and more policing. But, we already had an issue where they were sending troops out to Portland. They are trying to withdraw those troops, but I believe it's going to return again because of this pandemic and what has happened and how it's going to change things. And that's the unfortunate thing that I'm seeing possibly happening, that as this thing spreads, that the medicine, it's going to be hard to vaccinate everybody because some people are going to have their own opinions about whether they even trust the vaccine. You have some people that have conspiracy theories about the vaccines, or they feel they have their own cures, or they know that there's another cure out there, and there was one going around, a woman who was saying that hydroxychloroquine was a cure, and that she had the cure, and she had her own theories, and even Trump had spoke out on her. And so a lot of people say that some of these conspiracies or these theories and some of these things are unproven. They don't have enough documentation to prove that they work. Although you have people fighting against that statement, saying that, oh yeah, these things work, and then then you have a bunch of people using religion. And so whenever there are crazy things that are happening, crises, almost always you'll have these people that come out from out of nowhere with all these different ideas and conspiracies, and it's all fear-based, and some people find it as an opportunity to make money off of people and swindle people. So you have to be careful, and you have to use your own judgment, sound judgment, and see through some of the things that aren't true or don't sound like they might be valid information. So it's scary because people use these things and say they're cures, and come to find out it isn't. I think I even heard a story where people drank bleach thinking that was a cure. There was someone going around saying that he had the cure for coronavirus, but it was in fact bleach and something else, and people actually tried it and they got sick and they died. And so that's very tragic. So you have to be careful about some of the stories that people come up with. And, a lot of that is really, really rampant online. And then, too, you have a lot of scam artists that are trying to use this crisis so they can market off of it and basically steal from people and falsify information, maybe steal your identity. There's all kind of stuff going on right now. You wouldn't believe. There's a lot of anger. There's a lot of racism, racial issues that are going on as well. People putting that in this crisis as well, and it's rampant to the point where racism against blacks and Hispanics has been declared a health crisis, as within a crisis that we're going through here in America, and it's really scary. You have famine in Yemen, and you have probably what was I was reading by the WHO that there could possibly be a global famine because people are afraid of receiving certain foods because they're in fear that the boxes could be tainted with something, or the food could be tainted with the virus, or they maybe deliveries are slow because of COVID-19, that they can't get deliveries out on time, and that could also impact whether people eat or not. And so there's a lot of things that are happening that is really affecting everyone in some kind of way. And to the point to where we're going to see more chaos. There's been a lot of protests. There's been a lot of troopers that were deployed, and I believe 100 more were supposed to be deployed by Attorney General William Barr to Chicago and some other various cities. And the argument is that they were trying to suppress protesters' speech. What I thought was really horrible is to see that veteran guy that was in Portland, Oregon, have his bones broken simply because he asked a question. He was exercising his political right to freedom of speech. He wasn't violent, he wasn't hurting anybody, and he had his bones broken, and he was attacked by these masked people who claimed to be federal troopers that were deployed by Donald Trump administration. So this is crazy. So it has gotten really, really crazy, and I believe more crazy will happen in the near future. That is because there's going to be more people that are going to step out and speak out on issues. Recently, 3 of the officers have been trying to get their charges dropped from the George Floyd incident. That was another thing I noticed. And then what happened to, I believe, I'm not sure if it was Eric Garner. It was one of the children, young guys that was killed by a law enforcement, and they dropped the charges. They didn't want to charge the officer for shooting. I think it was Michael Brown. Correct me if I'm wrong. Let me look it up real quick while here. I believe it might have been, yeah, it was Michael Brown from Ferguson. The officer won't be charged for the 2014 killing of Michael Brown, and it's sad. And so it just ignites. It's like a recipe for disaster. And here you have this COVID-19. Most of the people who are heavily impacted by the virus is because of racial disparity and inequality, and people who have to be the essential workers and they have to go to a job. They can't work from home, or they don't have like a lot of asset money that they can just sit at home and wait things out. Um, and so that makes it problematic. And so a lot of people of color, black, brown people of color, are people who are poor, are not really able to just sit at home for too long. They might can sit for a while, but not for too long. After their unemployment runs out, and then they have to make drastic decisions on where they're going to work, which place might be safe. And if you're going to be around people, the more people you're around, the more you're going to be exposed possibly to this disease. And everybody doesn't come out the same way. Some people, even I heard people who end up with COVID-19 and let's say they don't die of it, they have other symptoms that are related to it and other illnesses or other things that might linger. And I even heard that people can get, after they've been infected, that your immunity to it doesn't last that long and that you can be reinfected. And so how does that work on your body? If you've been infected, you've been really, really sick, then you get reinfected, maybe you won't make it the second time around. And so there's a lot of worry, there's a lot of concern that a lot of this situation is not in the favor of people who are poor and poverty, or they're in vulnerable, marginalized positions of demographics, and race as well, background. And so this is scary. And so with all this going on, I don't foresee this really getting any better before it gets worse. And I feel like it will get a lot worse. And I feel like what is going to happen, there's going to be more protests and violence is going to increase in these cities. And even though you have these enclaves, these people who are wealthier, they're going to encounter at some point people who are not as wealthy. And if they don't make a sound decision to try to intervene and help where needed, and it doesn't mean just giving a few bucks, really try to give to the medical hospitals, to give to the communities that are in need, to help with maybe people's rents, maybe housing, make things affordable. Try to intervene, step in when you're needed. If people don't try to do something, there's going to be an unleashing, more of a reckoning that's going to take place and very soon, because this right here was not in the favor of anyone that is marginalized. Your life is at risk, your livelihood is at risk, your kids are at risk. You basically taken everything that people didn't have very much of, you put them in a vulnerable position and their backs are against the wall. It's like damned if you do, damned if you don't type of situation. And so that's where I believe it's going to get really ugly, possibly, because people feel vulnerable and desperate. And so that's pretty much it. I know this video is long, but I don't see it getting better for those reasons. Because so many people are suffering right now. Just looking at the news, when you, even if you don't want to look at the news, your mind in the back of your mind, how many more people are infected? What jobs are hiring? Who might have gotten sick on what job? Should I go to this job? Is it safe? Is it not safe? These are the thoughts that are running through the heads of people who are in these circumstances. Oh, I have this sickness. How is it going to affect me? Is it going to cause me to get more ill? Could I contract it? School's opening. What about parents? How do they feel? Are my kids at risk? Are my kids going to get sick and infected? Are the kids going to bring it home, and then I'm going to find out that I have something, So these are the things that I feel like a lot of people are probably thinking about, and it's going to affect so many people. And it's going to cause some people to be able to try to figure out how to make a plan to try to get through it as best they can, and then others are going to vent in ways that you don't even want to see. So it's going to cause more protests. It's going to cause more people to speak out. More people feel desperate. They feel despair because they don't know what's going to happen with it tomorrow. Everything is so uncertain and up in the air. And so with that, I'm going to let this video go. What are your thoughts? These shelters, I think we're going to see a lot more of these in the near future. And it's going to be for people that are homeless, and not just people who are infected, but people who can't pay their rent, or if they don't find a solution quick enough, we're going to see a lot more of these shelters. And they're not going to just be a COVID shelter for people who might be infected. They're going to be a COVID camp or shelters for people who are newly infected, because the moratoriums are eventually going to have to come to an end. They're not going to last forever. So, what do people do, during a crisis, having a crisis within a crisis? What about racial issues, the divide? Here we had John Lewis. He just passed away. He was pretty much a freedom fighter, a soldier, a hero, that we were fortunate enough to hear the stories of his journey in his life, and now he is only with us in spirit, and even to the very end he was protesting. He had left us with good words of wisdom. And so what do you do with all of this? So much has gone on in the past weeks. And so with that being said, I'm going to let this video go. It's unfortunate that we're living in times where it is so sad that, loved ones have somehow, not even a fault of their own, maybe have contracted this disease. They are very sick in the hospital, and they may die, or maybe they're getting over it and they have health issues outside of this. I don't know myself, but all I can say is that I'm seeing this not really getting any better. I don't know what else to say. I can't say well wishes. I would like things to get better. But from the way things have presented themselves and with who's in charge and the misinformation that we get, when they, started off, they downplayed the information. They weren't telling us everything. They were giving us bits and pieces of things, of information. And now that we know a lot more about it, time has progressed, and we've seen what this disease can do to people, where it can possibly strike. The questions roll around in your head now. How is it going to affect me? Am I going to get it? The fear. And so that's enough to bring people to the brink of wanting to riot. That's enough to make people feel fear that they need to speak out on issues and they need to demand answers, because your life is at risk here. Your children's life, your family's life is at risk. So I'm going to let this video go. Having said that, what are your thoughts on that? Because if they had told what we know now in the beginning, maybe not as many people would have perished under this disease. Maybe more work could be done to try to mend relationships with individuals so there wouldn't be this killing. Maybe some of the things that we've uncovered about law enforcement getting caught because they made up stories about people who weren't gangbangers and they said they were gangbangers, and now they have to check all those cases and put them on hold. Maybe if they weren't racially profiling people, that less people would be incarcerated. We wouldn't have this mass imprisonment like we do now, and also putting lives of innocent people at risk that are incarcerated for crimes they didn't even commit. So, having said that, like, comment, subscribe, and thanks for listening. Be safe. And this right here, I'm going to leave it on this photo because we might be seeing a lot more of these type of shelters, unfortunately. Good night.